Hi, I'm Dr. Athena with Tele-PT. Are you scared of pelvic floor physical therapy treatment? I'm here with Sister Thelma King in Salt Lake City, Utah, and we're going to talk about ways that you can feel more comfortable with pelvic floor physical therapy. First of all, I want to ask Sister King, were you apprehensive about receiving pelvic floor physical therapy treatment?
Of course I was. I didn't know what to expect. I was a little embarrassed because it's a private area. So, yeah.
And so, what were some ways that I helped you feel more comfortable with the pelvic floor exam?
Well, first off, she explained everything that she was going to do. She also used a sheet, discreet with the sheet, was wonderful, and felt more comfortable with that. She just was very comfortable herself too. She didn't act like she was embarrassed. She was very professional, and that helped me feel more comfortable myself.
That's right. And so part of the exam is a muscle assessment, a pelvic floor muscle assessment. And so what I like to do is I like to completely cover the area, her legs and my hand as well. And I talk with the patient face to face, and I say, I cue with my finger, like, let's see if you can lift this area or pull against this. And so that sort of communication, she really responded really well to that, and it helped her know exactly which muscles to use to focus her brain on lifting and contracting those muscles.
I felt very comfortable throughout the whole experience, and she answered all my questions, and actually it was a lot better than I thought it ever would be, so I was very pleased.
And so now we're going to move on to the second portion of this little interview, and that is her personal experience with her treatment. So I wanted to ask her, what did she seek pelvic floor therapy treatment for?
Well, when she told me that there was a chance that I could gain control again of that pelvic floor, I was so excited. And then when she explained the method that she used, and the main thing though was I was tired of having to use pads, and it wasn't getting better. I started out with little light pads, and then it ended up being, almost like a menstrual pad. And so, anyway, it was really an answer to a lot of the concerns I had about getting older too. So it was a wonderful experience.
Right. I talk a lot about how even though you're older, it doesn't mean your body can't adapt to that change, and your muscles are always ready to get stronger no matter how old we are. So that can be very encouraging to my patients. So she was coming because of urinary incontinence.
Bathroom, I was thankful for that pad, but it was really embarrassing, to tell you the truth. And so when she started talking about that I could retrain my body to actually control that urge, wow, it was just like a new lease on life.
Yes, it's so awesome. So what were some of the most valuable principles that you learned from pelvic floor physical therapy with Dr. Tele-PT?
Well, I think the main thing was the fact that I could gain control of my body once again. That was something that I thought was lost and would never get back. And through the therapy and the teaching of the exercises that she gave me, I was amazed. I really was. I went forward with a lot of gusto and determination that I was going to make this work, and it really does help to have that kind of mentality. It was win-win situation. I was ready to do it, and she had the therapy to teach me how to do it. And yeah, it was very successful.
Yeah, she made gains really fast. It was like, I think within 2 or 3 weeks she was seeing changes. And so we were moving on to other things that she was struggling with, and that's a whole other story, but it was really fantastic to see the progress. Do you use pads anymore?
No, I don't. That was the most amazing result of this therapy. I loved it. So yeah, I'm just a very happy patient that was of Dr. Athena's, and I highly suggest that you give her a try, and test out what her methods are, and I'm sure you'll be so satisfied.
Thank you, Sister King.
You're welcome.